Good afternoon. It's a pleasure to invite everybody back. I hope you've been able to have a little bit of a lunch break, and I'm sure some of you will have to be eating a sandwich at your desk. That's the nature of our new normal. My name is Petra Wilson. I am from a small consultancy called Health Connect Partners, and it's my great pleasure to be your moderator for this Oxford-style debate. A particular pleasure for me because I am a graduate of Oxford and I had the benefit of attending many of these types of debates. Now, an Oxford-style debate is a formalized debate where we have two sides, one opposing and one speaking for a particular motion. And the motion before us here today, and it'll come up on the screen in a little while, is this House believes that AI-driven innovation is key to alleviate the increased pressures on healthcare systems. And we have with us here today two great teams of 3 people each who will present the case both for and against this motion. We'll begin in a moment by giving you the chance to vote either for or against the motion. And you will then hear the arguments from each of the speakers. And you don't need to vote just yet, but you can do if you would like to. We will hear from each of the speakers in a formalized way, 4 minutes each, both for and against this motion. And I will in a moment present the speakers to you. Before I present the speakers to you, I would like to point out to you that this is to some extent play acting. The speakers have kindly agreed to speak for or against the motion, but that doesn't mean that this is necessarily their opinion, nor necessarily the opinion of the organization by which they are employed. We're very grateful to them for taking this moment to play with us in presenting for or against this motion. So I invite you please to vote for or against the motion, and I will close the voting after I have presented to you who our speakers are today. On the proposing team, we have Dr. Jan Kimpen, Chief Medical Officer of Philips, and Philips is also kindly the sponsor for this event. Jan leads the Philips Medical Leadership Team, where he has 20 clinicians and medical PhDs working with him with responsibility for advocacy, customer partnerships, clinical trials and market access. He's a frequent speaker on value-based care and digital innovation in healthcare and represents Philips on the World Economic Forum Global Future Council and also on the alliance with the American Heart Association and on the board of Sonara Ventures in Israel. His team members are Christina Sorensen, who is founder of the International Health Literacy Association and advisory board member of the European Health Futures Forum. She's in fact the first president of the International Health Literacy Association and is also a member of many other boards and advisor on the issue of health literacy for several organizations. And we have with us also on this team, Ricardo Castanera, Councillor for Digital and Telecom Coordinator at the Permanent Representation of the Portuguese Portuguese Permanent Representation to the EU. He is a lawyer by training, has worked in the technology sector with Microsoft and has had a political career in Portugal where he was elected for Coimbra. He has, of course, a very busy time coming up ahead now with the Portuguese presidency of the EU coming up after the German presidency ends at the end of this year. And this is our proposing team. Our opposing team, up on the slide now, Michele Calabro from the European Patients Forum, where he leads the activities on digital health policy. And he is also a former member here of EHMA, so he's to some extent on home turf. We also have Dr. Antanas Montvilla, who is the Vice President of the European Junior Doctors Association and who is a practicing clinician in radiology at the Lithuanian University Hospital. And finally, on the opposing team, we have Dr. Andrzej Ryś from the Director General Sante in the European Commission. He is also a medical practitioner in radiology by training and was for many years also the leader of the School of Public Health at the Jagiellonian University in Krakow, Poland, which is also from where he graduated. He's representing he's on the opposing team today, and that of course does not mean to say that DG Sante is against AI in healthcare, and we look forward to his arguments to see how we balance these situations out. So we should have the results of the opening vote with us now. I've asked everybody to vote. Okay, opposing team, you have a difficult battle in front of you. We only have 16 people, or sorry, 16%, and we currently have 53 people with us. I'm sure some more will join. 16% against and 84 in favor. The proposing team, that doesn't mean that you've already won, but let's see how we go. I'm now going to open, as I said, this is a formal debate. We have 4 minutes per speaker, and I'd like to begin the opening with Dr. Jan taking the floor and representing the proposing argument. Jan, the floor is yours.
Thank you very much, Mrs. Wilson. I'm talking to hospital directors and clinicians daily, and I feel their stress and their worry. The healthcare system is under severe pressure, with increasing burnout rates in the medical staff, substandard quality of care, and a disappointing patient experience. And part of this stress is caused by the overwhelming amount of data that both the healthcare practitioners as well as the patients need to process in order to get the best treatment, the personalized treatment to every individual patient, and for the patients themselves to help them manage their lives and their disease and their ailments and their disabilities as much themselves and at home as possible. Now, the artificial intelligence creates the opportunities in healthcare to help translate these large amounts of data into actionable insights. And these insights can empower clinicians, but also hospital administrators, patients, as well as health consumers to achieve better health outcomes at lower cost. AI, we have seen, especially during this COVID pandemic, is developing very, very fast and has the potential to improve and reshape healthcare. Applying AI in healthcare can improve people's lives across the whole health continuum by personalized lifestyle support, through targeted prevention of disease, earlier precision diagnosis and personalized therapy, and then at the end of the journey, giving patients the opportunity to monitor and manage their own often chronic disease at home. Now, there are 4 key opportunity areas as far as I can see. The first is to improve operational performance and efficiency of the workflows in the hospitals. Extracting insights from data, AI-enabled solutions can support clinicians to optimize their workflows, including planning procedure times and selecting the right exam for the right patient at the right time. Second, it is supporting high quality and integrated clinical decision-making. AI-enabled solutions can help to combine large amounts of medical data to generate a more holistic view of patients, supporting healthcare providers in their decision-making. The third area is empowering patients and consumers who want to live a healthy life to proactively manage their own health. Beyond the borders of the hospital, AI offers tremendous opportunity as it gets to embed it into solutions for home care and healthy living. And finally, the fourth area is enabling population health management, combining clinical decision-making support with patient self-management, population health management that can be benefited by these AI solutions. It will not replace healthcare professionals, but it will come as a tool, especially with COVID-19, but also beyond the COVID-19 pandemic. In order to let it work optimally, we will have to overcome some challenges, of course, such as interoperability, removing regulatory barriers and inconsistencies for cross-border data exchange, and creating a European health data space, and factor in training as well as education for the end users.
Well, I commend you. You have finished well on time. Thank you very much for that very clear argument. We're now going to move to one of the opposing team side, and I open the floor now to Michele to present the first argument there. Michele.
Thanks, Petra. Okay, my time has started, so I'll head into it. The patient community recognizes the potential role of AI in the future of healthcare. However, we still do not see it as the perfect solution to fix the issues in healthcare. As with all technologies, AI comes with a set of unrealistic expectations and challenges, including the dependence on good quality and unbiased data, which is an important challenge per se, reliability and safety, the transparency and ethical questions, the risk of limiting, in a way, human autonomy oversight, the potential impact that can have on diagnosis and treatment, and therefore on the life of patients. And this is also very much linked to the lack of lack of skills and knowledge from the patient side on how to engage, use, and aware on how artificial intelligence is already eventually impacting their life or could impact it in the future. And the latter is particularly important for the patient community, as we see as a clear risk of advancing of AI innovation and on policies on AI, leaving behind citizens that still do not have a full understanding of how this look and whether and where is impacting their life. Therefore, having a limit in terms of informing and meaningful involving the patient community in the discussion. And all these elements has actually been confirmed by a recent survey that we launched with our members, where, first of all, patient organization identify how the use of artificial intelligence among the communities is still limited or not present, or rather, it is not perceived as existing in a clear way. We have identified indeed a certain level of uncertainty on whether patients are actually using AI-based services or application, and they have a limited knowledge on the topic. And this clearly does not improve trust or acceptance, which is what uptake of digital solutions is ultimately based on, and I think we can all agree on that. And in terms of key challenges that still must be addressed before looking at AI as a real unique solutions for health issues, I just want to point out that it still we need to address the risk of incorrect diagnosis and other kind of errors that might come from this very interesting but still not finalized, let's say, digital health part, and the impact that can have on patients' life, the lack of clarity on liability, who should respond in case of error of an AI-powered machine or solution or applications, whether it's a chatbot or whether it's something different, the lack of transparency on how AI works, including the quality of data, the lack, as I mentioned before, of enough quality data and the risk of replicating societal biases. The unauthorized potential use of AI training data and outputs, and also the lack of involvement based on the fact that there's still a lack of knowledge on AI solutions. And this is, of course, very much linked to the risk in terms of ethics and reduced potential human interaction with healthcare professionals. Digital solutions and digital health should help and support, especially the relation between healthcare professionals and patients, and do not increase additional risk or potential stress for patients and an impact on the physical and mental health. Therefore, without the correct approach or without knowledge that we identified is still not there, AI will not potentially be able to bring the concrete benefits to the healthcare professional and patient relationship, which are indeed identified as a main expectation from the patient side.
Again, perfect timing. Thank you so much. I can see that we have a few new people who've joined us. So as you may have missed what's going on at the very beginning, this is an Oxford-style debate. We have a formal system of 4 minutes each for each of the team members. We have a team of 3 speaking for a proposed motion and a team of 3 speaking against the motion. And as I said at the beginning, this is something that we have asked people to do. It does not mean that they necessarily are vehemently for or against the proposed notion that AI has a key role to play in alleviating the pressures on healthcare systems. So that just for the benefit of a few people who I can see have joined us a little bit later. Let me also remind people who have joined us that there is a Q&A open. There will be a formal Q&A round after each presentation has been made. But you're very welcome to start already putting your questions into the Q&A part of this webinar so that we can start to collect those questions together. So thank you very much, Michele. I now move to the proposing team again, and I invite Christina to take the floor to take the floor for the motion. Thank you very much, and I'd like to hand over to Christina Sorensen.
Thank you, Petra Wilson, and thank you for the invitation to join this debate and being asked to provide arguments for. I'm of course very, very enthusiastic to have AI as a tool for dealing with the burden of disease that we see today. I speak about health literacy and digital health literacy, and health literacy is the ability for people to find and understand and judge and use information to manage their health and to cope with health challenges. And it's also about how then we, representing the system, really make information available and knowledge available for our users, patients, relatives, population at large, in a way that they can find, understand, judge and use it to take care of themselves. And as we now know, data and information grow at an exponential pace, and many governments, industries and organizations have really now turned to artificial intelligence to make sense of all this information and deliver meaningful insights for our citizens. And speaking about healthcare, AI has then the potential to really improve the services, and by developing and improve the development and manufacturing and of medicine, and also enhance the interactions with the users, doctors, and patients. And it's a growing feature which can really help us to improve the quality of our services, not only in healthcare but also disease prevention and health promotion, and really also health protection, which we, I think, all have to deal with here during the COVID-19. It can also really ensure that the patients really get access to information in a way they can fully understand, because we can use the data and help physicians to speak in a more clear language that people can understand. We know that the key barrier is often language and medical jargon. It's also time. And when patients are unfamiliar with a certain terminology, it can prevent them from accessing the right care and leading it to a higher risk of developing health complications and also subsequently costlier healthcare. However, AI can pull together patient reactions and feedback to terminology and suggest more user-friendly or patient-friendly substitutes for physicians to use at the point of care. And it can be as simple as explaining, for example, medicine dosage or interactions with other medicines. So with chronic diseases on the rise, patients with several conditions need to really keep track on various medicines, and often these doses are missed, or they think they can make up with the missed dose by taking a double one, and then of course this can mess up the whole treatment. And with the help of AI, physicians can then explain in simple terms the rationale behind not taking more than the prescribed dose, and also talk about the side effects. So I think there is a potential here to increase adherence and the way we talk to our patients and users through improving digital health literacy with AI.
Thank you very much indeed. So we've now heard some arguments for and against, and it's been, I think, very interesting to see these two sides from the patient perspective or the end user perspective, seeing both for and against. Just to remind you, and again, there are a few people who've joined us new, we had a vote at the beginning where you were invited to vote for or against the motion, the motion, I remind you, is this House believes that AI-driven innovation is key to alleviate the increased pressures on the healthcare systems. We had overwhelmingly 84% in favour and 16% again, and we'll be testing again, taking the temperature again at the end to see whether anybody has changed their opinion. But of course, the real objective is to get the discussion going and to hear what you think about these issues. So we have a number of questions already in the Q&A. I will open it to Q&A after everybody has made their presentations, so don't hesitate to put your questions already into the Q&A box. I would now like to move again to the to the opposing team, and I'd like to move to Dr. Antanas Montevilla from the Young Doctors Association to present his case. Antanas, if you are ready, we are ready to hear from you.
Yep. Hello, everyone. And
thank you very much. And I apologize, I said your surname horribly.
And it's not a problem.
Please.
So hello, everyone, again, and I'm feeling privileged to be here today. I think, as you might think, that as a young professional, I'm feeling disappointed in being in the opposing team, as I'm a kind of believer in technology in healthcare. However, I find it fascinating to learn a bit more about the arguments, and I'd like to against it, and I would like to share that with you. And before jumping to the innovation itself, you need to understand what kind of problem we want to solve using it. And innovation alone is not an end goal to succeed. We need to finally identify the fundamental problems we're trying to solve. And I see that the main problems are, first, is lack of education. As simple as it sounds, doctors are not being prepared to work in digital environment. We don't have any official training in Europe, neither internationally, neither nationally. We had a survey, we asked our member states, and we found that there are any countries that would provide proper digital health training for doctors. We need doctors to be equipped with digital health skills, not only to be able to use tools, but to understand how these technologies can change their practice. Another important point is that I think the increasing healthcare expenditures, we all see that the number we spend on healthcare is increasing and not always improving the outcomes. And in order, if we want to change that, we need to change the policies. We need to change and orientate our healthcare more towards outcomes or value. And I don't see how technology as AI can solve this problem. Another interesting point, I think, is the culture of medicine. It's still very hierarchical, and we might find the cases when the doctor is always right, or this is my patient. And if we want to change that culture, we need to find ways how we train our doctors. We need to improve working conditions, because the burnout rates among doctors is shocking. And if we're going to put another technological layer, which is one of the biggest contributors to burnout rates, it might even be the worst that we expect. So I think we should focus on how to improve working conditions for our doctors, how to improve the mental health, rather than hoping that simple technology, not simple, advanced statistical technology can help us to save our working conditions. Another problem I see that we believe a lot in preventive medicine, and we hope that AI will bring it to us. However, there are multiple policies that can be implemented, like better food for patients that need it, better restrictions on tobacco industry or alcohol industry, and we can achieve similar results without even investing so much money in the technology. Benjamin Franklin once famously said, "Well done is better than well said." And recently we hear a lot about AI. how hopefully it's going to change the world. However, if you would go to clinical practice today, as I do every day, you would not find any proper AI-based clinical solutions in healthcare. We have problems with reproducibility of these solutions, and there are no clinical evidence yet. And I think one of the most important questions for myself is that unequal digital maturity, and we have countries that invest a lot of money to AI technologies, and we have countries in Europe where still getting to GP or getting simple life-saving operation might be a hurdle. So I think if we will invest in the technology in not equal way, we might even increase health inequalities. And this is the thing we need to think about it. Thank you very much.
Thank you. Thank you very much. And it's very good to have the voice of somebody who is practicing medicine every day on our panel here with us today, but also to have, if you like, a little bit of a sobering reminder that some of the promise of AI is still to be realized. However, I mustn't say anything that influences the vote, so I will keep quiet, and I will move now to the next of the speakers speaking for the motion. And sorry, I keep having to say this, but we do have new people joining us all the time. This is an Oxford-style debate. We have speakers speaking for and against a motion, and the motion is: this House believes that AI-driven innovation is key to alleviate the increased pressures on healthcare systems. We are now into our last two speakers speaking for and against the motion, and I invite Ricardo from the Portuguese Permanent Representation to the EU to take the floor to speak for our motion. Ricardo, the floor is yours.
Thank you very much. Good afternoon to everyone. AI has the potential to bring about innumerable social and economic benefits. The COVID crisis is making this even more clear. Suddenly, we are locked at home, dependent on digital technologies to study, to work, to shopping, to socialize. And although not as much as we wanted, to have access to healthcare services. With the COVID crisis, the pressure on our healthcare systems was and still is huge. Some patients decided not to go to hospitals, fearing they would be infected with COVID. The hospitals in the hotspot of the crisis had to cancel surgeries, exams, prioritize between critical and non-critical patients. Of course, the crisis accelerated development and deployment of technological alternatives, telemedicine, for instance, but also accelerated the need to apply learning systems like AI to diagnosis, to predict patterns and respond accordingly. But to fully embrace the vast potential of AI, citizens and organizations need to trust it. So there is a broad perception among citizens of AI, which instead of triggering feelings of trust, efficiency, human advancement, triggers feelings of fear and rejection. Now, it's time to policymakers, and it's a duty to make sure technologies are secure and ethically designed from beginning. But it's also the duty of government and private developers of AI to raise awareness and knowledge about AI and how it works. Obviously, this is particularly true when we talk about healthcare. So, to trust technology and accept its incorporation in healthcare systems, we need to understand how the algorithms work and make sure it does not take biased or wrong decisions. In healthcare, biased decisions, as already has been mentioned, may have particularly damaging effects. Therefore, and we believe, we must ensure, first of all, that data used in AI applications is technically solid, is ethical by design, and is based on the highest quality standards. This is great potential of extracting knowledge and value from data, but if it is done in the right way, taking into account the societal and ethical concerns. The upcoming initiative by the Commission on health data spaces, from our perspective, will for sure contribute to this end. But we really do believe that to build trust, it's also important to ensure products are safe, including medical equipments which incorporate AI, and that an adequate liability regime for AI is in place. Of course, the issue is to identify where such liability should reside, as AI applications can have a very complex production chain and involving so many actors. Finally, To ensure the uptake of AI, we should also guarantee investment tools in research and testing of technologies. In Portugal, in our AI national strategy, we set up the what we called free technological areas, which we believe it's the right space to create a specific innovation context focused on testing emerging technologies before they entering the market. Thank you.
Thank you very much indeed. So we're nearly at the end of our session now, where we have our 3 proposers and our 3 opposers. When we finish, I will remind you again what the motion was, and then I will open the floor to start to answer the questions that we are beginning to collect in the Q&A panel. And of course, then I hope you will feel able to ask more questions. So it's my pleasure now to hand over to the last of the speakers, and we'll come back to the speakers again for a closing statement after the Q&A session. But the next speaker is Dr. André Rich from the DG Santé in the European Commission, and he is going to be speaking for the opposing team. André, the floor is yours.
Good afternoon, everybody. Good afternoon, Petra. You know, we are speaking about promising lands. You know, I heard so much, you know, about what this technology will give us. But, you know, frankly speaking, you know, the first question you may ask, you know, how does data will be produced? You know, why, you know, Jan is saying, okay, we are gathering data, we're having access to data. But what data? You know, today, the Belgian nurse, she told me she spent 40 up to 50% of her time loading data to the computer, and she's almost at a loss, you know, what for she's doing. So we're going to push them do more, as already was asked. How much time, you know, overloads, you know, workforces, doctors, nurses, whoever is there would like to spend of providing data to this beautiful, promising land. So the other problem, of course, is those data that they don't speak each other. You have, you know, many institutions, many ideas, many combination of different systems, standards, you know, and interoperability is not simply difficult, it's very difficult. Infrastructure behind is not yet there. How much time we need, how much more investment we have to put in this. Other ideas that you say we should use real world data, we should put the machine learning on machines. But of course, we need also, you know, community of practice. We need researchers. We need clinicians be involved. You know, where they are. Do we have this army of clinicians who can provide data, who can help? Should we employ them somewhere in the world? You know, what is the link, you know, to the global development? You know, how does algorithms will work in the Chinese or American or Korean or Australian environment, European one? You know, what is the culture? You know, how we are different as how we practice different in medicine. You go to the country I know best, and you will know that treatment of diabetes is almost, you know, different from one clinic to other, and we see this also in many other areas. You know, maybe diabetes is the rather positive. In the pain treatment, for example, you know, there are many protocols, many ideas how to treat. You know, many health providers, you know, have to be trained. You know, as already my colleague said, you know, you have to train people. They have to be skilled to work this as a professional. But finally, I would like to turn to the patients. You know, patients, already was said, you know, they want a doctor. They want to see human face. Do they trust this algorithm? They spend time on screen. You spoke about the population and citizens' access to everybody for prevention. But come on, you know, the people, they don't have connection to internet. They don't have machines. We see already in COVID, you know, how many additional, you know, divide gaps we are creating for children. They left school and they're supposed to have long distance education, but they don't have, because, you know, they don't have room, they don't have a computer, they have, you know, 2-3 other children, you know, accessing the same machine. So the division will continue. And finally, you know, we speak about biology, you know, how you make sure the biology, which is so different, every patient is finally different. Can this algorithm answer to all these difficult, you know, cases, you know, one-to-one, you know, how many of them we should create to support? And final question, you know, somebody asked me one day, you know, okay, this beautiful AI, but when things go wrong, who goes to prison? Are you going to prison computer in this nice cake, you know, to say, you computer, you algorithm, you are wrong? Who will be finally the one who will take responsibility? Over. Thank you.
We've now heard from our 6 panelists, and I just ask whether it's possible just to put the motion up again briefly so that everybody can see what we're talking about, because we have some new members with us. And if that's not possible, then I will just read the motion again. The motion is, this House believes that AI-driven innovation, I think it's coming up. Voila, this House believes that AI-driven innovation is key to alleviate the increased pressures on healthcare systems. Thank you very much. I hope that's reminded everybody, and we can now move back to the view where we have our panelists. We're getting some questions together, and you can also use the voting system, incidentally, if you would like a question that's already been asked to be answered. And as you vote for it, it will also move up the list. So I would like to therefore begin by a question that comes to us from, I'm very sorry in advance, I'm probably going to make horrible messes of people's family names when I don't know them, from Sophie Belos, who says, thank you very much for the interesting views, but she asks, she makes the point, data is power, and asks therefore, who should have the power over AI and to decide what to do with data? So that's a nice opening question, and I will go around the table to ask you each very quickly to answer that question. Jan, I'd like to start with you. Who do you think should have the power over the data?
I think as a principle, the data are owned by the individual people where this data come from. So basically the patient. Looking at AI, however, we have to train our algorithms, and that will need a large lot of patient data to train the algorithm and to validate the algorithm. And there is a very individual that delivered its data, that the algorithm should be built on a set of data that is representative for the whole population on which the algorithm is going to use for afterwards. And we see now a lot of reports in literature and of messages in the press that algorithms that have not been trained for the general public can give the fault results when they are used for a population that was not in the testing group to start with. And we have, out of respect of our patients, we have to be very careful to take them all in so that we can also use the algorithm for everybody.
Thank you very much. Michele, what would you like to say to that question?
Well, on data, clearly, I mentioned it as it is clear that is what AI is built on, and you know, fixing the issues that are still there in terms of data, especially if you're looking at the European dimension of data and AI, and we're talking about the European data space and so on. There are still some challenges that needs to be addressed, which are, yes, indeed, you know, how our patients can be in control and access their data, considering the difference across countries, because they're still there. We have countries that are more advanced in this. There are countries that are a little bit behind, especially if we're going to look at something that has a European level. We should really try to make this work as much as possible in a harmonized way. And another point of another challenge for sure is it's in terms of the avoiding replicated biases with artificial intelligence if the data is biased itself. So that's, I think it's a major question that we see when it comes to artificial intelligence, and it's something that needs to be addressed even before arriving at AI, but really when discussing data.
Thank you very much. Christina, how about from your perspective in health literacy?
Yeah, I think basically most people really would like to support the public good. And I think very much about it as a blood donor. You can be data donor and donate your data to these algorithms so that we can improve basically health for all. However, I also need to then be sure that there is a system like the blood donor, that my blood is taken care of and that it will reach the right person and the right purpose. So as long as we have a system built up around that, I think many people would actually contribute.
Thank you very much. I'm sure we may well come back to the question around data donation. I have to say personally, there's always a slightly interesting issue for me, because donation implies also the fact that you can sell. It implies ownership. It might be another issue that we come back to. But I carry on working, giving you each the chance to answer. So Antanas, from a practitioner's point of view, how do you see this issue?
I think this is one of the biggest issues we're currently facing, and I completely agree with Jan that the ultimate owner of data is the person. And however, how to give them access to their data is another question. And I think needs to be, I would say, discussion with this broader society. We can't basically kind of decide for them who and how we do with that data. I think it's extremely hard to do. However, we have, like, even within the European Union, we have different cultures with different point of view. They are nations are extremely open, and they share their data because they trust in the government. We have countries that they don't trust in their government, and everything needs to be based on trust. And I think this is the question we need to understand with and to answer with the further discussions. I think from technical point of view, from medical point of view, we would like to use these amount of data in our clinical practice and would like to build the models on as much data as we can. However, even within one country, few institutions, they don't like to share the data because now they're starting to see the benefit in that. So of course, like more national or even international approach to the data would be extremely beneficial, but how to organize that? I would say this is the question for another topic debate for the few hours.
Thank you very much. Ricardo, this may well end up on your table in the next presidency. So what's your opinion?
Well, first of all, we talk about data, but the data, they are not all of the same nature, not equal. There is a very different kind of data, okay? And then we believe that the approach to AI has to be also very coherent with the European strategy for data. And for example, normally in few days, the Commission will come up with a very concrete proposal on Data Governance Act, for example. And then we're going to know much more about how to share data among business, but also how to making public sector data available for reuse, how to allow reuse of personal data with the help of a new concept, which is a personal data sharing intermediary. This is a new discussion that will come up in a very few days, but it's absolutely linked, or it should be as most as possible, linked with the upcoming proposal on AI. I think that we cannot just talk about the data on healthcare, which is, of course, for sure, one of the most critical ones, and it drives us for the discussion, which is a very topic one about the high-risk applications too, because the applications, they are not also, they don't have the same kind of level of risk. But, well, the message here is the need of a strong alignment between the different proposals that will come up during the upcoming months and for sure during the Portuguese presidency.
Thank you very much. And Andrzej, coming to you to answer the last word on this question about who should have the power to decide what is done with data.
We are also in the area, in one here is data protection. So basically, as I am opposing, I always say that the giving data today is so difficult, because we are protected also by quite strong regulatory framework. Even Europe is seen as as a worst place, in the world, for the data sharing. I don't like to say that I believe in other options, but it's what we hear from some friends around the globe. The other problem is data quality. We give data, but if my data from my heart monitoring are very badly recorded, or I use wrong equipment, or this was wrongly downloaded by the system, simply the quality maybe is not the same, or could be completely misleading. And then lastly, I think the big question is about the influence of on data from other factors, like psychological behavioral factors. We are humans, and medicine is about the human. And always we say medicine is an art. So how does data correspond to this art concept of medicines? This is also tricky area. And final word on the who can help. We don't have right regulatory body which can really help. We do it when we go to the bank or to the financial sector. We have institutions that take care of our money. When we do medicines approval, we have European Medicine Agency. How we are going to make sure those data gathering, then the creation of algorithms, whatever is used, how that are used, or even predict to be used. Simply we don't have any institution which can really give kind of rights or the message to the patients that the data are not misused, or basically they are not corresponding to the aim of the collection.
Thank you very much. So we've had a bunch of answers there, and I think in your answers you've already started to deal with some of the other issues that have come up. There are two questions which have 3 votes each at the moment, and I will come to those in a moment, but I'd like to actually just take a step back from some of these more abstract theoretical questions to come to something which is very close to everybody on this panel, and I would imagine the vast majority of the people in our audience, which is what do you believe the European institutions can and should be doing to help us face the global competition in the AI race? Do the European institutions feel the urgency? And perhaps we can roll into that question also, combine with it the question of, will the European health data space be a key tool in addressing this? You're obviously still on your for and against sides, but I think it's useful to get your opinion on where the European Union stands, how it's equipped in the race to be leaders globally in AI, and in how far the European health data space can be a key part of that. Jan, come to you again, please.
Yes, thank you. I think it is of paramount importance that we go to a European health data space as fast as we can. We know that there is some initiatives on cloud, on the European cloud, but we see already the critics coming up, countries that do not want to buy into that, and before we know it, we will be passed left and right by China and the US. I think this is a big issue that in Europe we have to address, to create our own cloud-based health data space in order to share and exchange patient data in a safe and secure way, I would say, but that is obvious.
Thank you very much. Michele, is Europe well equipped?
I think it has to be well equipped, and it's going in the right direction, I believe. It looks like, as Ricardo was mentioned, it looks like, at least from our perspective, that the health data space and the work on AI is coming together as a package, and it has to be in that way. And I think especially, part of the question, if I'm correct, was on where we position Europe against USA and China. I think this is quite well reflected in the way that the Commission proposed the way forward for the data space of artificial intelligence on excellence and trust, and based on the European values. I think that's absolutely important. That's something that, of course, also the patient community feels it can contribute to if the values that will be built on are closer to what it's needed for citizens in general in terms of data protection and ensuring that these frameworks are designed to meet people's needs. Because I think it will also come to have a balance between kind of horizontal approaches and specific approaches to healthcare, which is quite important given the impact that all the digital solution and AI can have in healthcare, and the importance of uptake for digital in health. And we've seen it also recently, with the tracing gaps, how uptake is important to have them impactful for public health benefits.
Thank you, Christina. And I remind you, please stay tight in time, because then we can get through more questions. Christina, over to you.
I was just thinking that, having traveled in Asia and working closely with Taiwan, and also traveled in China, where especially China, they have a lot of smart clinics, and it seems that they are far ahead than we are in Europe, and they are developing another kind of culture, which we haven't really seen yet in Europe. So I think we can learn a lot from our Asian colleagues, and it also has to do then with the culture. So how the big question is not only to have platforms, but also to build a culture of using new technologies. And I firmly believe that we need new technologies to solve the problems we have today. So that is just a comment on this.
Thank you very much. And Antanas, to you from the medical professional perspective.
I think, to be honest, we're not kind of leading in this subject. I would say that the US and China, they are way ahead because they may be more unified. I would say it's easier for them to implement kind of national-wide solutions rather than US. It's easier for them because all the states are closer than in Europe. And in terms of data, I think it's super important that we start talking about digital data space. However, if we will get that data there without kind of proper preparation, I think it would be unfair to even talk about AI solutions. However, because having data is not like having AI solution, because working with the data is 90% of time. So I think for us, we just need to be honest with ourselves and with the kind of people, saying that, okay, maybe we're making baby steps to finally creating those data storages, and then maybe we'll start build on that. And I think there's a long journey, and we need to be more into working rather than, saying how we're going to change the world with the AI. Just keeping to my argument.
Thank you very much. Ricardo.
Well, I really much agree with what has already been said, but just to emphasize that, and we believe that has been the right approach from the Commission. When we talk about trust and excellence, the two, I would say, pillars are absolutely key to get these, to make AI development with the full respect of European values. And we think that that's the right approach, because it will give us, as European, and to the European companies, but also to European citizens, advantage, a competitiveness advantage. We believe that can be the game changer. But of course, we are really expect to see what will be into the details. But Michele mentioned a very important point, which what happened with recently with the COVID tracing apps, when suddenly we had several different kind of models, centralized, decentralized, not all the member states launched at the same time, and now the Commission came up with the need of having a platform, a gateway, exactly based on to increase or enhance the interoperability. This is a very good case for us to understand how to move on when we talk about, for example, AI.
Thank you very much. So I realize that with this question, we've gone a little bit away from the core of the debate, but I think nevertheless, it's a really important part of exchanging information. So Anjay, you're the last speaker on this question. It's of course not fair to ask you whether you think the European health data space is a good idea, because I don't think you're going to say no. But what do you think, how can it help us in the race to maintain our position as global leaders?
You know, it's a very simple answer. You know, the European Union is not about European institutions. It's about the 27 member states, you know, and many regions and many hospitals and many cultures, many languages, you know. So our from the beginning of this race, we are in the much more difficult positions than any country in the world, especially speaking of China or US, you know, comparing, of course, the different. So this is why I think it will not work if all this, you know, effort by member states, by individual hospitals, by all stakeholders will not be united, you know. So the answer, still in my shoes, you know, of today's debate is that no way, because, you know, we are so different, you know, and simply we lose this battle because we are so different.
Thank you very much. Now we've got a very little bit of time left on the debate section, and I'm conscious that in the questions that we've chosen, there's perhaps been given a bit too much opportunity to the pro side, because I've let you I've let everybody say things which are quite in favor of the AI argument. So I'm going to ask the last question and ask you each to comment briefly on the question which has the most votes at the moment, which says, in short, when we use AI in healthcare and we want to focus on the whole patient population, are we following a holy grail in AI? Do we actually know the consequences long term of what we're doing, and is it worth the risk? So I invite each of you to speak on that one, which is a question a little bit more critical of AI. Jan, I would like to ask you that question first.
Yeah, very fast. We are on a journey. We don't have we have the North Star in mind, but we do not know the journey towards that North Star, and we will have to be very, very careful to deal with AI in a good stewardship-like way.
Thank you very much. Michele, what about you? Holy Grail?
Well, not now. Not now. There's a lot of things to do still, especially from the patient community, to build the trust and the knowledge that I also mentioned before. I think it is a road we need to take, but we're definitely not there yet.
Excellent. Christina, is it worth the risk?
Yeah, and I think we have to think it not as a revolution, but an evolution, and take it step by step and see what works and try to take away what doesn't work.
Very good. Antanas, how do you feel about the last question?
Oh, I'm happy that people are also raising opposing questions, and I of course agree that it's not the holy grail. It's just, I would say at this moment, there's advanced statistics, and the more you get involved in it, the better you understand how limited it is in this particular moment. Maybe in the future, definitely will play a better role, but I think we're getting it, you know, it's solved by that we're gonna solve multiple complex problems, but by now we just can solve a very tiny bit of that. So just be aware of this and not buy into early.
Thank you very much. Ricardo.
Well, as I've said before, AI, it's not an holy grail, and AI regulation should be focused on high-risk applications. That's our vision, and the high-risk applications should also be evidence-based. It means that we cannot treat all of the risk on the same way, and the applications that are not also the same kind of. But yes, indeed, there is a long way in front of us.
And Anjay, the last word on the questions.
I think I can only refer to Mr. Tech, Mr. Musk, who said that AI will be the last things humanity has done, you know. So I hope, you know, AI in healthcare will not do the last things to the patients, you know, completely cut them from the human relations with the doctor and nurse and the caregiver. I can tell you, my father, who is taken care by people, he really prefers to be taken care by the nurse, by the caregiver, than by any smartphone, you know, or his Nokia, you know, his not smartphone.
Okay, so yes, thank you for bringing us back to that human element, and that's also reflected in some of the questions. I'm very conscious of the fact that we can't go through all of the questions. I'm hoping that the panelists will have been able to read some of the questions and will be able to perhaps pick up some of those issues within their closing statement. But we're still in our formal Oxford debate, and we have 1 minute for each of the presenters to make their closing statement. And with the closing statement, and also just to make sure everybody's still on their toes, I'm going to turn the order around. So I'm going to ask actually Dr. Risch to present his closing statement. So 1 minute to make the closing statement against the motion that AI will alleviate the problems. So Dr. Risch, to you for your closing statement.
Okay, so for my part, you know, we are in this journey which bring us a lot of unknown ideas. There is nothing like free lunch. We know this as a manager very well. Innovation is great, but also can bring harm, can take our privacy. Still, the safety is unknown. We don't have right infrastructure. We don't have way of pay for those using AI. We see the growing gap, digital gap between those they can use and they can provide technologies. And finally, you know, will not find so much benefit. And I will repeat my question: who will go to prison if things goes wrong?
Well, I hope none of us, but Ricardo, closing for the motion.
Yes. Well, what can I offer and say as incoming presidency? First of all, we will play an honest broker role, but we want to ensure that there is a regulatory action at the EU level that can avoid fragmentation, first of all. Second, that it must be a smart, flexible regulation. It has to be ethical, trustworthy, and future-proof. It means that we should avoid, of course, excessive, unnecessary regulatory burdens, but at the same time, health is at the core of the welfare state in Europe. And this is absolutely critical, that the creation of an European data spaces for health is a very good start to overcome all the obstacles that we have already identified, and also to encourage health research partnerships across Europe and development of an European health solution. Thank you.
Thank you very much indeed. Antanas, to you for your closing statement, please.
Okay, so I would like to say that I believe that we will use AI in the future, and it's going to play a role, at least in healthcare. However, expecting it to be a silver bullet to all our fundamental problems, it would be unfair even to the AI. And I think we tend to overestimate the chance that they're coming in a few years, but we underestimate chances it's going to be in 10 years. So for us, I think we need to identify the problems we want to solve in 10 years. For example, training of doctors, improving healthcare workforce, reducing health inequalities, finding right policies for prevention. And only then we can use AI as one of the tools, one of many tools in 10 years we're going to use to change our healthcare. I think this particular crisis we face now showed us that we face the crisis of healthcare workforce. We need people who actually would be in a hospital and would care for patients. And I think AI can't solve this, and we need to focus on healthcare workforce.
Thank you very much. And Christina, your closing statement for the motion.
Yes, I think it's here to stay. I think it's a bit like when you change from horses to cars. So it's here to stay, and the front runners already have the ideas on how we can use it. I hope that we can combine the human and the digital impact so that it's will be 1 + 1 will be 3 instead of 2, and really maximize the impact. I also think that it's not the AI that will determine the outcome. It's really the human force, the human workforce, but we need to teach them, we need to teach citizens what all these new data can be used for, with the purpose to really inform and qualify treatment and prevention and health promotion to be much more fit for purpose than what it is today.
Thank you very much. Michele, coming to you for the last statement against the motion.
Yes. Looking at the COVID crisis, it's clear that we need to innovate healthcare, and AI as digital health as a whole will play a part of it, but we're still not there yet, and we cannot afford to leave patients, citizens, and healthcare professionals behind in developing and in going forward towards AI. We're still not there in terms of a lot of things that were mentioned today. Data, unbiased security, quality data, the skills for professionals, skills and literacy for professional and patients, knowledge, the level of trust and acceptance of AI as a tool that can improve healthcare solutions for patients, for professionals, and not replace but improve human care. We are looking forward to have AI to improve this. But it has to be calibrated on the real needs of those who will be affected, that will use artificial intelligence. We have the chance to do it now, but we need to make it really happening.
Thank you very much. And that leaves us with Jan to give us the closing statement for this proposition.
I am very bullish to listen to our healthcare professionals, especially the young ones as Antanas. And we did this in a study we commissioned this year, where we did a big survey of young healthcare professionals. And they told us that they really believed in artificial intelligence to enable their work in the future, because they are the future, if we can provide them with solutions that integrate seamlessly in their workflow, in the hospital, so where we can combine the digital and the human part of the work. It can also enable patients to take care of themselves. But if we do not listen to these young healthcare professionals in a very, very constructive and deep listening way, we will lose them. And therefore, with that, we will lose our future in healthcare.
Thank you very much, and for that positive ending. So we are now going to ask you, the audience, to vote again. I am conscious of the fact that not all questions have been answered. We've tried to combine some to answer them. If any of the panel members would like to answer any of the questions, you're of course welcome to do so by typing an answer in. Excuse me. However, you'll appreciate that it's not possible to get to all questions in a debate like this. So let's see whether we've had any change of heart and how you, the audience, feel now about the motion. So if we could have the slide with the motion again and the opportunity to vote, and then we will come to the close of this session. Can we have the motion, please, and the vote? So I hope everybody is voting. We have a good number of participants with us. We've had an active debate. We've heard both for and against the motion, and we've further enhanced our knowledge with the question and answer round that we've just had. And as soon as my colleagues and Emma are ready, I think we can close the poll and we can see how the audience feels now. Okay, well, the against team, you've done a good job insofar as you've made people think a little bit more about the motion. The House believes that AI-driven innovation is key to alleviating increased pressures on healthcare systems. Now, as I said at the beginning, This was to some extent a game, and of course we don't expect any of you to go away and fall on your sword about this now, and we also don't expect anybody to be 100% for or against any of these opinions. I think we've heard some really interesting points of view come up. I was asked to make a short roundup, which of course I can't possibly do, and this audience knows much more than I do about all of these topics. But a few things that really stood out for me, which I think are really important to take away with us, and they are the following. This is a journey. We don't necessarily know everything yet. It's not a silver bullet. And if it's a journey, that means we need rules for the road, and that brings with it all the issues of facing the regulatory burden. And we recognize the fact that the European Union is part of solving that regulatory burden, but is not the whole story, because the European Union is 27 member states and they have to help make and implement those rules. We've noticed that the European health data space is a significant start, both for changing the care of patients and for driving research. But again, that too is not the silver bullet, and it's also part of the journey. We've heard some issues about the risks in terms of particularly further burdens on the workforce, potential burnout for doctors and other healthcare professionals, and the need to really ensure that we maintain the human connection. And I think that's a point that several of the speakers ended with, that notion that there is a human element. And whether we say it's the human element of recognizing that the European Union is its citizens, not the European Commission or the European Parliament, and healthcare is about real people, whether they are patients, informal carers, healthcare professionals, or all the other real people we have in it. These are the issues that we take away and that we must bear in mind. I'm not going to give my opinion on whether I think AI is the solution or not, but I really would like to thank Emma, Phillips, and of course our 6 panelists for giving us such an excellent debate. Thank you very much to everybody, and I think we finished just on time. Thank you.
Thank you.
Thank you. Bye-bye.
Bravo, Chair.
Thank you.
Well
Thank
done.
you, Andrew. Bye-bye.